Hi, my name is Jana Justice, and I am a career counselor at University of Houston Career Services. I'm excited to be presenting you today on how to interview for health professional schools. So just to go over what kind of topics we're going to be talking about today, if this is the first time you're interacting with our office, I will share what resources are available to you as a student. And we also will be talking about what to expect before your interview and how to prepare before you go in, what to say during the interview process, and how to follow up after. So to tell you a little bit more about University of Houston Career Services, we're the office on campus that supports both undergraduate and graduate students with whatever you need in terms of finding a part-time job, internship, full-time job, or applying to graduate school or a health professional program. So there's different ways you can connect to our office. All our services for the fall will be virtual. The first way you can connect to our office is by scheduling a career counseling appointment through Cougar Pathway. So the topics that you can schedule an appointment for include everything from resume reviews all the way up to salary negotiation. The appointments are 30 minutes and you can make as many as you need. And then even after you graduate, you have up to 6 months to utilize our services for free. After that, we have an alumni subscription. It's $50 for another 6 months, but it's still access to all our services. So that's a really great option for students who may be taking a gap year or taking a couple years to work before they apply to the health professional program. In the fall, when school starts, we will be starting back our virtual chats. When you go to our website, you'll see a Get Help function on the right-hand corner. When it's red, it means it's active. So in the fall, the virtual chats will be active from Monday through Friday, from 10 to 12 and 2 to 4. Those are really great opportunities for you to chat. So it's just a text chat feature with a counselor. They're short appointments, so they're 10 to 15 minutes. But if you have a quick question, want a quick review of your resume, the virtual chats are great options. Now, if you have a question that may take a little bit more time, I would really suggest using the 30-minute appointment so you make sure that you have all that time you need to discuss with your counselor. In addition to meeting one-on-one with students, we also do provide workshops and career fairs for students to attend. These will be virtual as well, and you can look at our website under the events tab to see what events and workshops we have for the fall semester. You can also RSVP for them through Cougar Pathway. You do have to RSVP for both events and workshops in order to get the Microsoft Teams link to join the session or event. So Cougar Pathway is our online platform. You'll see it through Access U Age. This is where you can RSVP for events, make a career counseling appointment. We also have a job board. So the job board doesn't only have part-time jobs on campus. It also has internship opportunities, full-time opportunities in Houston, in Texas, and all over the United States. What I like to tell students is that employers, they're the ones who go and post on Cougar Pathway. So they know you're a U of H student, know you're a current student or a recent grad, and they want to hire our students. So when you are looking for opportunities, start on Cougar Pathway first, because you have a pool of people who want to hire you. So before we begin, just to give you an overview of what our goals are for today. First goal, learn how to prepare before you go into your health professional interview. And our second goal is really going to be to learn what are the different types of interviews you may encounter, and then how to go about answering traditional, situational, or multi-mini interview questions. So you got the interview, congratulations. Now, what to expect next? So once you get to the interview stage of the application process, something to really consider is at this point, many of the candidates probably have similar test scores to GPAs. So when you get to this final stage, what the admissions committee is really trying to see are those aspects of yourself they can't get from application. Those are going to include interpersonal skills. So they want to see in the interview, one, your motivation. Thinking about medical school, they want to see, are you ready for the next couple 4+ years ahead of you? Do you have that motivation to continue? They want to see your empathy. Can you empathize with your patients who are going through a really difficult time? And your cultural awareness. If you're applying to programs in diverse cities, they really assess this because the patient populations that you'd be working with will be diverse. So they want to see specific examples of when you've worked with diverse populations in the past. They also want to assess your personality. Maturity is a really big factor. Being in the healthcare profession, you will have to address really hard topics, and they want to make sure that you have that maturity to be able to do that. They want to see if you're a team player. Everyone from a doctor to a technician, everyone's working in a team setting. So during those interviews, they're assessing what does your being in a team for you look like? Are you someone who contributes? Are you helpful? And then your service orientation, or you're wanting to be in the healthcare field. Lastly, thinking and reasoning. Critical thinking and communication are essential in the healthcare field, and it's something you have to already come in with. You have to have the foundation. So the Healthcare Admissions Committee is trying to assess this because they won't have the time once you enter into your program to teach you these skills. So they want to see, when have you critically think in the past? Because if you're in a situation with a patient and you have to quickly come up with a solution, you've got to use those critical thinking skills. And they want to see your communication, because your communication is everything from a patient to different healthcare providers, insurance companies. So it's really important to know and for them to assess, when have you used your strong communication skills in the past. So what type of interview formats could you encounter? So with COVID right now, what I'm telling students is really be flexible in terms of what the program tells you about the format. I'm sure many of the programs want to do their interviews in person for this upcoming cycle, but they may also be playing it day by day just to see what it looks like when they get closer to interview season, to see, can we invite students on campus or do we need to do it face-to-face? So be flexible with that process. For this slide, I'll be talking about what it looks like if you are going face-to-face for your interview. And then other couple of slides, I'll be talking about what to look out for when you are doing if you do an online interview format. So if you are invited for a face-to-face interview, typically they're half-day interview events. So they do different components throughout the day, such as maybe a campus tour, information sessions, a lunch break. Even though there may be downtimes or more settings where you're in lunch, where you're having more conversations outside of the healthcare field, you still want to remember it's still an interview. So all eyes still are on you. So make sure you're still in that professional headspace. And then once you start doing the interview portion throughout the day, you could have a couple of different types of interviews you conduct. One could be the traditional one-on-one where you're meeting with one person, but you could also be in a group interview. What that would look like, it'd be you and other candidates interviewing you at the same time. What they may do is they may address a question to the group and ask each person to take time to answer, or they may give you a question and ask the group to discuss among themselves. A panel interview would be when there's more than one interviewer. So just to give you an example, at University of Houston Career Services, when I interviewed for my position, I had 13 people interview me. So each person took a question and asked me, and I responded, and then the next person went. With the group and panel interviews, typically admissions committees will do this for a couple of different reasons. One is just more time effective to get more candidates through. And two, they also sometimes want to assess, let's say in the group setting, what does it look like when you're in a group with someone? If we bring you into the cohort, are you interacting with people? Are you maybe not interacting? They're trying to assess that portion, and the panel too helps them see with faculty members. If you are interested in particular research, which may be faculty member or person in the admissions committee, maybe who can we connect you with to further that? So with online interviewing, before COVID, many programs were using a specific software called Casper to send to candidates once they had completed their applications. So what Casper is that it's a software that has 12 sections that are completed within 60 to 90 minutes. And really the point of the specific software is to assess those personality, interpersonal skills that we talked about in the beginning. To see, based on this, do we want to bring you in for that face-to-face or online interview? So each section is either comprised of either a video-based or word-based scenario. So what this means is that for one question, you may have a video that has a certain scenario. Afterward, you'll answer 3 questions about how you respond to that video, or if that was you in that video, what would you do? A next question could be a word or text-based. So it's still a scenario, but you're reading instead and doing the same thing, answering 3 questions based on what you may do, how you may respond. So you're not recording yourself during these during each of the questions, but you do have a short period of time to answer. You have 5 minutes to answer the 3 questions that are given. So you have 5 minutes to type out your responses. Now, once you get to the final stage and they do decide, no, we're doing an online interview, again, that's where that flexibility is going to come in. Each program may use a different type of software, Zoom, Skype. So be flexible with them. If it is a more broad software like Zoom or Skype, make sure you test out those settings beforehand. Make sure your username is appropriate, especially if you have, let's say, Skype from high school. Easiest thing is just to have your first name and last name, and ensure that your privacy settings are on. So some online interviewing tips. Online interviewing is different than face-to-face, just because there's some nuances you have to think about that you wouldn't have to think about if you were meeting with someone in person. Like I said earlier, those testing capabilities are really important. You are probably going to be nervous the day of your interview, and you don't want something like you're not able to connect to the software, you can't hear them, maybe your video is not working, to make you more nervous. So to try to prevent those nerves as much as you can, test out all those items before your actual interview day. Also make sure that location of where you're doing your interview is going to be appropriate for that day as well. So as much as you can, try to find a quiet space where you're at. Also check on the lighting. If you're facing a window, the lighting can be really good, but if the window is behind you, the light can actually make the screen really blurry and it may be hard for the admissions committee to see you. Close any unnecessary web browsers, tabs, and applications. So with all the communication that we have now with chat features, emails, a lot of these notifications have sounds. I know personally, if my email sound goes off, I can get easily distracted. And you don't want to get distracted during the conversation with the admissions committee. So to minimize those distractions, only have the browsers up that you need during the interview. Dress professionally. So dressing professionally in general just puts you in that right mindset of, I'm in the interview, I'm ready to talk about my skills and why I want to be in this health professional program. You also want to sort of test your clothing or what you're going to wear with the webcam before, just to make sure that if it's a really bright color, again, it can have that blur effect. So making sure that the clothing you're wearing, lighting setup, all of that it's good so that you're coming out clear and you won't come out blurry. You can have a pen, notepad, and copy of your resume on the desk. So if you're someone who likes to write while you're in an interview, just let the admissions committee know beforehand and ask them, say, hey, I like to take notes when I'm in interviews. Is it okay if I take notes? If they say yes, take your notes, but make sure your eye gaze is on the admissions committee and the interviewer more time than it is on the notes. You can use hand gestures, so it is perfectly okay. Just anytime with your nonverbals, you can have them, but make sure that they're not super exuberant, that it becomes distracting, they're not listening to you in your conversation. And with online interviewing, I think what is really interesting is that our nonverbals don't come out as much as they do in face-to-face. So you may find yourself, when you're practicing, even listening, nodding, smiling a little bit more to convey it through the camera. Place your phone on silent. So if you're someone who it's really hard to be away from your phone, put it on silent, put it somewhere else so you're not getting distracted. And I would say my number one advice for online interviewing is your eye gaze. So this is the biggest difference between face-to-face and online interviewing, is that how your webcam is positioned. Naturally, when someone's on the screen, we want to look at their face, but their face is not positioned where the webcam is. So you may be responding and looking at someone's face on the actual screen, but it's going to appear that you're looking off when you're responding because of the webcam. So when you're responding to a question, look directly into the webcam. I've had students tell me that they actually may put a sticker or post-it next to the webcam just as that reminder. And then when the interviewer is talking, that's when you can put your gaze back on them on the screen. So it is technology. As much as we try to make sure that everything goes smoothly the day of, there may be situations where the technology ends up not working or something gets distracting. So what happens if your video or audio stops working? Ideally, you would have contact information for the individual who set up the interviewers or the actual interviews themselves. But a lot of the software nowadays, Zoom, Skype, has a chat feature that if you need to text them really quickly and say, I apologize, I'm having trouble with my audio or video, do that. See if you can fix it. If you can, go on with the interview. If you're not, give them a call or chat them and ask them if you can reschedule or do a phone interview instead. Now, what happens if a noise interrupts the conversation? Maybe construction, a lawnmower, sirens. At that point, if it is going on for a while, apologize. Let them know you're going to mute for a second to let the noise subside. Once the noise subsides, then you can put your audio back on. Now, on the other hand, let's say if someone walks unexpectedly into the room. Same thing, apologize. This time you're going to turn off both your mic and your video. Talk to the individual. If it's a pet, you may need to put the pet in a different room. But when you come back, turn your video and audio back on, and then proceed with the conversation. So how do we prepare before we go into the interview? Preparing is key, especially for health professional interviews. What you may hear from candidates who've gone through the process or are in any kind of health professional program right now, sometimes they may say things like, mine was an open or closed interview. So what that means is if the interview was open, the interviewers had access to your application materials. So what they may do is that they may go through your application and specifically ask you questions based on it, on your personal statement, on your activity section. On the flip side, a closed application would be that the interviewers have not seen any aspects of your application. So all candidates really at that point are on the same playing field. Either way, whether it's an open or closed application, you do need to know your application inside and out. For the open application, it's important because if they ask you a question about, let's say, a certain activity, you got to be able to respond and give an example. And with the closed application, because they don't know anything about you, you really have to be specific when thinking about your application and what you want to share with them. So when we're talking about ourselves, I have had students say, you know what, like it's not comfortable. It's not comfortable for me to talk about myself, and I find it really difficult. So I know it can be really challenging, and for a lot of people, they feel they may not be humble when they are talking about their experiences, their accomplishments. But I really suggest for students, think about reframing this as you're really just stating facts. So if you're pulling information from your application, at the end of the day, that's a fact because it's something you did. But when you are reflecting on your application, reviewing it, something else you want to think about is what makes you unique from the other candidates. Remember, other candidates are being assessed as well, so you really have to show the admissions committee why you're a good fit for this health professional program. So what are examples from your experiences that would make you a good candidate? And more importantly, what are some skills that, let's say, would make you a good nurse, a good occupational therapist? What are some skills and what are examples of when you've showcased those skills? So spend some time in introspection, thinking about these areas, it will make the process of interviewing much more easier, more comfortable, because you'll feel prepared knowing what you want to say during the day of. Another way you can prepare is scheduling a mock interview. So through Cougar Pathway, you can schedule a mock interview with the University of Houston Career Services counselor, and you can really make, again, as many mock interviews as you need. When I work with students, what I do is that the first time that we meet, I ask them, do you want to first talk about what the interview process looks like? Do you want to practice a couple of questions? Or do you feel prepared that you want to practice this like if it was the real interview? Whatever stage you're at, we'll practice it that day, and then the next interview, we maybe take it up that next step. If you were maybe just talking about in the beginning, maybe we're answering a couple of questions back to back. So typically you want to do a couple rounds of mock interviews, one, just to know what kind of questions are asked, but also two, to get rid of some of those last minute nerves and make sure that you have all your questions answered too. So if you are going face-to-face for an interview, other ways you can prepare, thinking about what to bring. You can bring a portfolio. A portfolio, it looks like a binder, and it comes in different colors. It doesn't have rings inside, but it does have slots to keep your documents, pens, anything you may need the day of, and it just looks a lot more professional than maybe carrying a regular folder. You want copies of your resume or curriculum vitae. They'll have them the day of, but this can be really beneficial for you if there's downtime and you want to quickly review your application, resume, and your documents in between. Thinking about where to go during the day of your interviews. So if you are applying to programs, let's say out of state or far away, let's say El Paso or Lubbock, you do have to think about coordinating flights to drive beforehand. And then whether you are applying for a program in Houston or, again, out of state, a different city, thinking about how do I get to the actual interview spot. So I like to use the medical center as an example. The medical center has many different garages, and each garage leads to a different hospital. So you may be trying to get to Memorial and you enter into one garage, you're really in Texas Children's. So again, we want to try to prevent your nerves as much as possible. So before you go to the interview, see if you can find the location, see what parking looks like. Do you need to walk to the interview? Do you need to pay for parking? Try to assess all that the day before or a couple of hours before, so when you actually arrive to the interview, you're not having to worry about that portion. And then again, if it is online, try to find a quiet location. I know this can be really difficult, especially if you live with family, partners, have children, but as much as you can, try to find an area where you won't get distracted so you can pay attention to the interviewers, but you also feel comfortable and relaxed that you can have that conversation. One of the questions you'll probably be asked is, why are you applying to our program? For a lot of students, I know location is really important, so they may say, well, I want to stay in Houston, this program's in Houston. But you got to dig a little bit deeper, because the admissions committee wants to see what specifically about our program attracts you. So thinking about, why did you decide to apply to the program? Was it their mission and values? Do their values connect with yours? And then you want to give specifics behind that. Is the program doing anything unique or starting something new? Will you get a chance to work with the populations you're interested in? To give an example, the UH Medical School is really unique, not only because it's just started, but that their specific focus is to work with underrepresented populations. If that was a population you were really passionate about working with, and you applied and you've had that experience working with those populations, that's something that you could share in an interview and give specific examples. And is there any faculty you'd be interested in working with? So if you're interested in conducting research or maybe getting a conjunction PhD, you may look at the faculty beforehand and see what are their specialties, what is their research, and that's something that you can actually bring up in conversation during the interview. You also want to practice your nonverbals before you actually go into your interview day. So your nonverbals are really your first form of communication with someone. Different kinds of nonverbals. When we get to that point again, where we can start shaking hands. First contact is usually a handshake. So you want to assess, are you shaking someone's hand too hard? Are you shaking it too weak? Nervous facial expressions. This is one I see a lot when practicing with students, especially if you're given a question that maybe you weren't prepared for. It's really easy just by instinct to scrunch our faces, look really scared. So what I suggest for students is that when you're practicing, practice in front of a mirror so that not only do you hear yourself, but you can also view your facial expression. If you see yourself maybe scrunching your face when you're answering a question, stop, breathe, and then practice it again until your face is more relaxed. And that's going to be almost like a monetized. Slouching in chairs. This can be hard, especially in an online interview if you don't have a table set up or maybe you're not sitting on a chair. So as much as you can, try to sit up straight, because if you're slouching, it's going to appear to the interviewer that you're not interested in the conversation. Playing with items. If you're someone who gets nervous and naturally maybe plays with a pen, hair, something that's nearby, put those distractions away. Don't have the pens near you. You can even pull your hair back if you know you naturally grab it if you get nervous, because again, you don't want that to be distracting during the conversation. Hand gestures, can have them, just don't make them too distracting. We talked about eye contact, so even in a face-to-face, you have to maintain eye contact with the interviewers. It is natural to look away when you are thinking about a question, but you want to make sure that most of the time is spent looking at the interviewers. And most importantly, I would say, especially for online interviewing, when we get really nervous, right, we naturally just want to say our answers out loud, but we want to make sure that we are, one, really listening to what the interviewer is saying, and we want to make sure that we're not cutting them off or maybe speaking too quickly. So when the interviewer is talking, give them a 1-second pause just to make sure that when you think they're done, they are done before you start proceeding with your response. And then lastly, it is okay to smile and be excited about the interview. However you express your enthusiasm, express it during the day of the interviewer, because they do want to see that you're excited about potentially being in their program and that you're interested in that specific healthcare field. So don't change your personality the day of the interview. I know sometimes students may say, well, I'm not naturally bubbly, but I'm trying to make myself be that way. You don't have to do that. Be your natural self, but however you naturally show that enthusiasm, show it the day of. And lastly, we want to get our professional attire ready. So like I said earlier, that professional attire is really important because it puts you in that professional mind space. Even if you're doing online interviews, I would still highly recommend to dress professionally from head to toe. Again, to be in that mind space, to be in that set. With your professional attire, do suggest a blazer, a long sleeve shirt, any neutral colors, black, gray, or navy. For your shirts, white, neutral colors again. If you're going face to face, make sure that your pants are not too tight, they're not too baggy. Shoes are really important face to face, especially if we're thinking about doing those on-campus tours. You will make sure that you're comfortable throughout. And accessories such as a professional bag or that portfolio. So now that we're at the interview, what I really want you to remember from this presentation is that when you're at the interview, you need to show the interviewers versus telling them. And what I mean by that is a lot of times when individuals are in interviews, our instinct is to be really broad. So if we look at traditional interview questions, if we look at number 6, why do you believe you would be a good fit for this program? Someone may say, I have really great empathetic skills. That's telling the interviewer, and that empathy, that's really important in a healthcare setting. But if I have 5 other candidates and I have to assess which out of these candidates has the strongest empathy skills, you just telling me doesn't really help me make that assessment. But you showing me and give me an example of a time you were empathetic does. So when you are responding to your questions, think about, am I showing my skills? Am I showing my experiences? Or am I more telling that to the interviewer? With the traditional interview questions, tell me about yourself. Why do you want to be a doctor, nurse, physician assistant? Why did you apply to the program, and what are your short-term and long-term goals? These are pretty standard for most interviews that you'll see. When we go to other types of questions, situational interview questions, these are questions that if you hear, tell me about a time, describe a time, give me an example, that'll be a situational interview question. What they're trying to assess is they want to see how you handled or reacted to a situation in the past, because most likely you'll handle or react very similarly to the future. So when you're taking that time to do that introspection, reflecting on your application, also think about times where there's situations from your jobs, volunteer experience, internships, research, anything on your application. Think about maybe those best moments and some of those challenging moments. The reason why is because if you had a set couple of examples that you can pull from for the situational interview questions, it'll be a lot easier to answer them versus if you're asked and then you're having to think on the spot. You don't need a lot of different examples. If we give an example for, let's say, tell me about time you worked on a team, that one, same example, you could probably maybe use for another, give me an example of a time you worked with a difficult person, because maybe a group team member wasn't turning in their work. So when you are presented with a situational interview question, a way you can answer it or format your answer is called STAR. It stands for situation, task, action, and result. So when you start off with what you want to tell the interviewer, you first want to say the situation, so what was going on at the time, and you can be really specific. Then you want to talk about the task, so what were you tasked to do? Action, what action steps did you take? This is really important in terms of you taking those action steps. You want to pull examples where you are showcasing those actions versus, let's say, someone else. And most important, the result. So the result's important because if you talk about everything that went on and then your action steps, but you don't talk about what happened at the end, it could leave the interviewer wondering. And you don't want them to wonder, you want them to get that full picture. So an example of STAR includes these couple next slides I'm going to show you. So let's say we were in an interview and I gave this candidate the question, tell me about a time you solved a problem. And they answered situation. During my third year of college, I was elected vice president for the Pre-House Student Association. The duties of the position included securing speakers for our meetings, introducing speakers, and evaluating each program. What was their task? Previous attendance at meetings had decreased substantially due to a decrease in membership. The goal was to implement programs to address the interests of our members and recruit more students to join the organization. So what action steps did this candidate take? I assembled a team to help with the program and speaker selection. I developed a survey to determine the members' interests and ideas for possible speakers and topics. My team and I had each member complete the survey. Then we randomly selected members for a focus group interview. I had learned about this research technique in my marketing class and thought it would help us identify why attendance had dropped. What was the result? Because of the information we gathered from the surveys and interviews, we selected speakers for the entire year, produced flyers describing each program and the featured speaker. Under my leadership, membership increased by 50%. So from this one example that the candidate shared, not only could I see that they solved a problem, but I saw a lot of other great skills as well. I saw that they were really innovative in taking the focus group concept they learned in their marketing and implying it. I saw that they have that marketing skill, and that's something that I may not have known before. But if the candidate would have been more broad with their response and saying our organization wasn't getting enough members, we asked them what they wanted, they told us, we created flyers, it still would have shown that something was updated, but I wouldn't have had as strong as an impact as when the candidate was detailed as in this example. Another kind of interview you can encounter would be multi-mini interviews. I would say these are more prevalent for medical schools, physician assistant, and pharmacy, but other programs and other healthcare fields are starting to use it as well. Very similar to Casper, except this isn't in person. They may be doing it potentially online as well. But the multi-mini interview questions really get at those critical thinking, interpersonal, and personality characteristics. So typically there are a series of 6 to 10 mini interviews. There's a couple of different formats you could encounter if it is face-to-face. It could be going up to a door where the question is there. It could be going up to a desk where the question is there. But what the format looks like is that you go up to a door or desk, you flip over the question, and you have 2 minutes to think about the question, how you want to respond. Once those 2 minutes are up, then you go inside the door, or the interviewer will be there at the table, and you have 5 to 8 minutes to respond to the question. Now, the questions can vary. The questions could be anything from scenarios, questions about policies in the healthcare field, acting, so you may be acting or playing out a role with the interviewer, ethics, traditional, or even some quirky questions. So for these next couple of slides, what I'm going to do is I'm going to go over some of the more common questions you may get in the interview process. And the first one typically is, tell me about yourself. So what is your story? A lot of times when people get the tell me about yourself question, this can be really challenging because it is really broad. But think about this more as, what is an overview of your application, your resume, your curriculum vitae? What are those top 2 to 3 moments that have gotten you to this point of applying for the health professional program? Those experiences can be personal as well. So it is okay to mention, say, maybe your personal experience on why you're entering to this healthcare program, but you want a combination of both personal and professional. You do not want to include personal interests or hobbies. So if you're like, I really enjoy golfing, or I really enjoy dance, save that more for a question when they ask you, what are your hobbies, or what do you like to do to de-stress? This will typically be the longest response at 2 minutes. Face-to-face. I will say with online interviewing, you may see that's a little bit shorter. With online interviewing, everyone's attention span tends to be a little bit shorter as well. So you may find some of your responses shorter there, but in a face-to-face, it'll be 2 minutes. Why do you want to be a physical therapist, speech language pathologist? So really think about those experiences, again, that have help you decide, I want to be in this healthcare profession. If you are going into professions that may be similar, such as nursing, physician assistant, doctor, a lot of times they ask specific questions of, why did you decide to be applied to physician assistant school versus nursing or being a doctor? So they really want you to have a really good understanding of why you're picking this specific health field. So thinking about any shadowing or direct patient care experience that you may have that made that impact, how your skills, personality, and values align to the profession. I've heard students who are interested in going into physician assistant programs that they may sense something like, you know what, I have a more flexible maybe personality that I like to try different things. And I know being a physician assistant, I'll have the opportunity to be able to go into different sectors of a hospital. And that aligns with my personality, maybe my values as well. Tell me about a time you solved a problem. So this is going to be that situational interview question. So we're going to use the STAR method. So first, keep it positive. Try to pull experiences where it ends in a positive note. If for any reason you pull an experience and maybe it doesn't end well, keep going with it. Just make sure you put a positive spin to it at the end and say, this was my learning lesson from it. So anytime you're discussing something maybe that doesn't end the best or doesn't put you in the best light, it is okay to be honest, but always have that positive spin and talk about that learning lesson. And remember to be detailed with your responses and end with the result. How did COVID-19 impact you? This is a new question that a lot of candidates in this cycle are probably gonna get. So again, be honest, but show solutions. You may have been affected, maybe your classes, maybe they moved all online, and maybe online is not your preference for taking classes. Again, be honest with it, but show how did you adjust. Maybe you put together a study group. Maybe you took extra initiative to go to more online study hours. If it impacted shadowing, how did you gain additional experience? Maybe you didn't get additional experience in the healthcare field, but maybe you joined different online volunteering programs, or maybe you ended up doing a certification or taking a course. So end with a positive note on how you adjusted. They want to see when you were faced with a difficult situation, how did you make the best out of it? If you were emoji, what emoji would you be? So this is one of those quirky questions. It's a personality question. So really no rhyme or wrong reason for any answer, but they want the why behind it. So stay positive. Describe the why behind your choice. If you are the happy emoji, talk about why you're happy. I had a student share once that they were the happy emoji or the laughing emoji because they like to make other people laugh. And that's what they would also take to a healthcare setting. Think about the values and skills of health professionals and how your answer connects to that. So this one that we have here is a Multimini interview question. So it says you are in a program and notice that a fellow classmate, Michael, often shows up late or slightly hungover to class and patient visits. One day you find him in the break room alone. You decide that you want to talk to Michael about this. Please enter into the break room. So after those 2 minutes, you would enter into the room with the interviewers and you would give your response. So with multi-mini interview questions, what you want to do is you want to think about both sides of the situation. So you'll notice in the question that it says Michael appears hungover. We cannot automatically assume that he is. Michael may have a medical condition. Michael may have not slept, or he may be going through emotional distress. So don't automatically assume one side. Think about different situations and think about the multi-mini interviews as you processing out loud the different situations. So let the interviewers know, you know what, it may appear first that Michael is hungover, but I gotta also think about maybe he is taking certain medications, maybe he's not physically well or emotionally well. So think about those different situations, talk them out loud with the interviewers, but then you do have to either pick a side or pick a follow-up. In this kind of situation, I would stress the importance of changing the behavior because no matter what's going on with Michael, if he's not presenting his best self in the rounds or the clinics, he's not his best self for the patients, and that is critical in a healthcare setting. And then following up with that, taking it a step, maybe what are some resources you provide to Michael? All this you'll be talking out loud to the interviewers, but they want to see that you can think holistically about the situation or look at all aspects before you make your final decision. So when you get to the end of the interview, they will ask, what questions do you have for us? What I would recommend is before going into the interview in that preparation stage, have 5 questions. You can list them or write them down in your Padfolio, ready to ask. I recommend 5. Most likely you'll only be able to ask 2 or 3, but have 5 just in case some naturally get answered during your interview. With the interview questions, really you can ask any questions you want. I just wouldn't ask questions that would be easily found on the website. So questions can include, what qualities do you look for in an applicant? What would a typical day look like for a first year? What do you enjoy in the program? What led you to become a speech language pathologist, optometrist, nurse? I read that first years get to work with blank population. Can you tell me more? I saw that blank research is done. How can students get involved? What are the challenges that students face during their first year? And anything else you generally want to know. So once you're done with the interview, what your last step will be is either following up with an email or a thank you note. Email is a lot faster, so if you do want to send a thank you note, I would still send an email first, just so it can arrive quicker. Typically, the follow-up email, the recommendation is at least 24 hours after your interview date. But the thank you email does not have to be long, and nor should be long. It really will be a short paragraph just thanking the interviewers for their time. If there was something that you had a shared connection or you just had a really good conversation, you can mention it in the note. Maybe one of the interviewers was also a fellow Cougar. You can write that in there. And then you can end with, I'm excited to hear the final decisions. If you would like additional information to support your decision-making process, please let me know. So with thank you notes, a lot of times individuals don't get thanked for taking the time to do the interviews, because even with admissions committees, some of the individuals are on there, that is not their full-time job to do these interviews. So it does take a lot of time out of their schedule. So really being thankful, not only that they took the time to interview her, but that you made it to that interview process, really leaves a lasting impression. So here are some interview resources with some of the questions that we practiced today. I did pull from these different websites, so you can continue to practice by going on these websites and seeing what additional questions they have. But for any other support with your health professional interview, you can always contact us. These are our different social media platforms, our website. But most importantly, if you are in the upcoming cycle for your health professional interviewers, make sure that you schedule a mock interview with us today so we can help you practice and feel most prepared for the interview day. Thank you, and we look forward to working with you this upcoming year.